Hi, my name is Pushpak Niwar. I have been working with HI in Nepal since 2007. In the month of April and May 2015, the capital of the country and the countryside were hit by two massive earthquakes and its aftershocks. More than 22,000 people were injured and around 9,000 people lost their lives. HI was one of the first NGOs to respond to the crisis. Responding to a crisis of this level comes with a lot of challenges. One of the first challenges faced by the HI team on the ground was the difficulty to access to people with injuries. With so many people being injured and brought to the hospital, the lack of a defined trauma pathway was one of the big challenges for the team to reach out to the people in need. With limited rehab capacity, the earthquake and its aftershocks brought suddenly an increased number of caseload at the hospital, which is difficult to manage. Natural disaster like earthquake causes multi-trauma and a lot of complex injuries. With the limited skills of the staff who are non-specialized in trauma management, it brings up a challenge to manage these cases well. Early rehabilitation can help the medical team by freeing up beds in the hospital. Rehabilitation team would need access to assistive devices to mobilize people with injuries. Lack of assistive devices creates a hindrance in early mobilization of people with injuries. Many reasons why HI was able to respond effectively to the earthquake. Well, one of the most important reasons was the coordination effort that we put in place from day one. The rehab team was in coordination with all the major hospitals and trauma centers of the capital where most of the people injured were brought in. So from day one, the rehab team was able to access people with injuries and provide them early rehabilitation services. Sudden increase of caseload, the team of rehab professionals were trained on triage. So the people with minor injuries who were categorized as green in the triage process, the rehab team helped in their early mobilization through the provision of assistive devices. So the triage process is very helpful in effectively responding to this increased caseload. HI had invested a lot in the training of the health professionals, including doctors, nurses, and the rehabilitation staff in management of trauma and trauma protocols. This was very helpful in responding to the complex case management. This, along with the availability of trainers in the early days of response, helped to improve the skills of non-specialized staff, and this is very vital and very important to respond to a crisis like earthquake, which includes a lot of complex cases. As HI was working already in country and a stock of assistive devices were pre-positioned, this was an invaluable resource during the early response, where the team of physiotherapists and rehab staff had access to assistive devices, which was used in early mobilization of people with injuries.